Good morning, Salone people. I hope everybody's doing okay. I'm Dr. Fatufona, Amina Dr. Fatufona, an obstetrician gynecologist. And I just want to give a really quick response to, some of the itopo I don't see they go around in some of the groups. It refers to a student, in secondary school where the whole thing just very concerning about the moral, waiting at the moral, how parents then for handle this, they need for pay attention and talk about this student way. First of all, teacher discipliner. It sounded like the teacher discipliner or bitter, and then knocking Anne begin bleed. Then find out say he get waiting called captain band, which is it's an implant, it's a contraceptive implant. So then the write-up just go into a tangent about how why Pikin forgets contraceptive implants, they know for the get sex. It just went on and on and on. And I was just so shocking to me, say that that kind of idea and still exists about viewing the fact, say, for me, a Pikin way for be commended, a teenager way, no say sexually active and get contraception for keep and insect from get belleh. The way they write about it, I just made it sound so bad. And kind of ensuring, then they get parents then for say, oh, you need to get a handle on this, will not for let this happen. So I just want to give my perspective, first as an obstetrician gynecologist, as a doctor, and also as a mother of three teenage daughters. Couple of things, I think, say, the sexual and reproductive health of anybody in an insect getter, then that autonomy, that you forget control over your body, and I don't think so we need to take that away from each other. I think so as parents, yes, we get the responsibility for guide we Pikin them. We all want we Pikin them wait until they're in a very good relationship, until they're married, maybe even if they plan for married, or they in that kind of solid relationship and older and financially able before they start for get sex and get belleh and all of that. That's the pie in the sky waiting all parents want, right? But the reality is, we get to understand, say, the average age, I know the numbers in the US, for example, the average age we begin in the beginning get sex now age 17. I am sure it is much, much, much lower in a lot of African countries and in Salone, because Salone, we get a very large number of we begin we don't, the get belleh and born as teenagers. So we know, say, as teenagers, people are having sex, whether in the upline, whether in the free tongue, wherever they're having sex as teenagers. And we get for understand that. And I think as a parent, our responsibility is that we begin them able, we give them the opportunity and counsel and guide them enough, let them take responsibility for their sexual and reproductive health. And I think it starts with you as a parent for giving them that, let them understand that, let them not begin hide by you, then do all things and get belleh, and then it's you have a bigger issue. We all, I think, say, if you are a parent, you would want let you Pikin get contraception rather than you Pikin get belleh way old 15 or 16. I think so if you ask anybody that's what they would say. So just mere advice and coming from a doctor standpoint, what we recommend is that yes, you start to get a teenager, you need for them, from even when before they're a teenager, don't they talk to them about them body, how them body they change, talk to them about sex, then get for no. You cannot hide anything, and this is a normal human phenomenon. If you think about yourself, not begin be hypocrite. When did you start thinking about having sex? Who say you begin thinking for get sex? Who say you actually get sex? So keep that in mind. So make sure, say, Pikin they understand, number one, so they know they abuse them because they understand, they know what thing for happen. Number two, so they're able to prepare. What Pikin they need for know is that before they become sexually active, then for don't know about contraception, then for don't know about condoms, then for don't plan, let become sexually active by mistake, for don't plan, say, okay, now so and so, I think in my mind when I want to become sexually active, and I prepare just in case. Then for no say condom, now they protect them from infection, and then they've always used condom when they get sex. And then for girl bikini, they need reliable contraceptive method. And one of the reliable contraceptive method they captain band or the implant. When a long-acting method and they put on, it last, for a couple of years. And if you get sex, fine, you're prepared. If you don't get sex, also fine. So, what to make you recommend is once you begin age 15, by the age of 15, 16, me personally recommend you take it and go see a doctor, a gynecologist if you did, or your nearest health clinic. Let them begin get a discussion there about contraception. Let them know, say, available. So I can tell you what me do. For me on picking them, once they turn 15, 16, now me self, now you can't see me or they take it and go see me colleague when a gynecologist. I get a discussion, say they're of this age, we don't they discuss all this time, but I don't think say they're of an age where they need a relationship with a doctor, so that they know say we as parents give them that authority. They whenever they're ready, we don't need for necessarily no, but whenever they're ready to have sex, they get that, they know say them prepared. So like me, I take me Pikin go, left line, go see the gynecologist, we get a discussion, I walk out of the room, whatever discussion they get and whatever they plan for do, that's between them. Then get a doctor-patient relationship. When somebody 15, 16, 17, not all you business again on their reproductive health, you guide them, but you also get for let them, kind of make the decisions. And I think what you do as a parent is, if you don't they prep them from within 4, 5, 6, 7, 8, 9, 10, 11, 12, they talk to them about their body and think, then it's not a strange thing, right? So let them get that discussion in, and then allow them to go see the gynecologist once a year on their own. And they can make that decision. And I can tell you for me, where they see me on patients, and the parents, where they bring them picking them for cancer, me with them 15, with them 16. Most of them picking them, they're not sexually active. All I do is I they sit down, I they talk to them, I they guide them, I they counsel them. And me on counseling, what they give them is it's best for delay for when you get sex for as long as possible, until you mature, until you're ready. And then when you're ready, now the option they are available to you. You get this captain band, you get birth control pills, you get intrauterine device, you get all that device here, plus always use a condom. And that way you're ready when you're ready for get sex. And a lot of people you can find out say, they say, okay, I'm not sexually active and I'm not interested right now. Some of them, within the last, 1 or 2 years of high school, they will kind of say, okay, I think say I'm ready, I want to start this method. Or when they go away to college. So I implore you as a parent, now that kind of strategy that you need for make sure say you Pikin safe. Because what's important overall is that you love your Pikin and you want you Pikin safe. I should say most of we, whether you Pikin be doctor or lawyer or accountant or business person, or so you want let them go on and do something with their life. You know, I let them get belleh when they were 16 or 17, just because you get this idea in your mind, oh, not to me Pikin or mix by that, so you just let it suffer. Then you get other problem then day. So I would implore that possibly write this, and the groups, if there are groups of parents, think about it. The professional opinion is really guide your child well, let them know what your thoughts are, that yes, you want them to wait as long as possible, but that you also support them. And if they decide, say, they want to get sex, give them the tools that they need for protecting their own sexual and reproductive health. Yes, let them know, say, for use condom all the time. Let them know, say, that for don't get contraception in place before that first day when they get sex. So do you a big on share this year? We need for combat all this fake morality. Because of fake morality, the right thing can be big threats where say, by the time you get secondary school, you say be on the get sex. So why you they make all this? And I commend that Pikin Day. If it is indeed a true story, we take in sexual and reproductive health. It take charge. It makes sure say get birth control, because now Pikin way better. It's serious. You want to go and do something better. No one get belleh when you hold 16 or 17. And that's the type of child that we want to see, or teenager and woman that we want to take control. So dear Aya, I just wanted to come here. I know it's long, but to share this.